And with daylight saving time this weekend, we are falling back to earn an extra hour of sleep. I spoke with a medical professional who shares how it affects our sleep health.
We do know that circadian rhythm is basically a natural process that occurs that is really tied into our bodies based on the exposure to light, the night and day cycle. And what happens when you disrupt that cycle can lead to increased amounts of stress. It can place stress on the body. It can cause increase in blood pressure, to name a few. You can also see some changes in terms of metabolic regulation. When a person is not sleeping when their circadian rhythm wants them to sleep, they definitely put themselves at increased risk of other health problems.
Why is sleep so important to your overall health?
We spend about a third of our lives sleeping. We do know that sleep helps with restoration and recovery of the brain. We do know that there's new data that shows that getting good sleep provides sort of a cleansing effect to the brain over time. We have to understand it from the fact of what happens when we don't get sleep. And we do know that we feel worse, we're more fatigued, more tired. And so the benefits are immense in terms of improving overall health, metabolic health, as well as providing energy levels to help people focus and to accomplish what they need to during the day.
We're going into daylight standard time. So that extra hour, does it actually affect us in a negative way, and how does it impact our sleep?
This time change really is not that harmful. We do see benefits to that extra hour of sleep on this weekend. Where you see the problems really lies with the transition to daylight savings time, which occurs in the spring. At that time, we do see an uptick in some cardiovascular events. There has been some studies that have looked at increased heart attacks during that first week after the changeover, but we do see a decline in that effect here in the fall when we are falling back.
When we switch back later, what are some tips or recommendations that you have to getting adjusted so that our sleep patterns aren't disrupted?
When we are looking at the spring, I think it's important for people to understand that, hey, your body's going to be not readily wanting to wake up at the time that you're going to have to wake up. And so you need to make preparations to go to bed a little bit earlier, plan your days and accordingly, turn off the TV probably an hour or so ahead of time, or cut off the phone a little bit earlier too.